Let's now take a look at the oral cavity of this cat. You can see in the caudal soft palatal region we've got a defect, a V-shaped defect. And this is termed soft palatal dysplasia. It's a congenital condition that symptomatically results in chronic nasal discharge, regurgitation through the nose of food and or water. And in many of these cases, most of these cases, we can resolve these with surgery. And this was one that was probably moderate to severe in relation to others that you might see. And the way we approach this is to separate that palate into two layers, the nasal and oral mucosal layer. And we'll show you a little bit more detail about that in a second. This particular patient was suffering from a chronic mucopurulent nasal discharge. You can see here we have evidence of that. And then when we anesthetize this cat and put it into dorsal recumbency to start the surgery, we had this discharge that we had to remove from the defect and the caudal oral pharynx prior to starting the surgical approach. Here you can see a little more detail about the anatomy. What we've done is we've gone in with a scalpel initially, made a little incision right at the margin on each side here of the defect, and then take a scissor and use that to separate the oral mucosa from the nasal mucosa. And there is a muscularis muscle in between those two, separating that out, going lateral and caudal in order to get enough freedom of movement of this tissue in order to bring it together without tension or with minimal tension to close. And we close this in two layers. We close the nasal mucosal layer first, and then we close the oral mucosal layer second. And generally, as long as there's no tension or very, very minimal tension, which in this case, because of the size of the defect, we did have a little bit of tension in the caudal aspect of that, we generally get great results, and this cat was no exception to that. And you can see we've got a complete resolution. This patient was totally non-symptomatic following surgical success in this case. Some of these cats, as very young kittens, do not make it past the early neonatal days. They develop aspiration pneumonia and pass, unfortunately, but occasionally you get these that do, for some reason, make it through that early period, and we have an opportunity to cure them surgically. We're looking at the right mandible, and if you were to look at this and examine this cat, it would be very difficult without magnification and without a good oral exam to recognize this problem. And if you look at it radiographically, you can see exactly what's going on. We've got a tooth here that's not supposed to be here. There's no tooth, there's no second molar in the cat, so this is just a total aberration and growth of a tooth that doesn't resemble any normal tooth in the cat at all. But what we're seeing is already, and this cat's fairly young based on the pulp cavity diameter here, less than 5 at most. We've already got some periodontal bone loss on one plane, and that would